It's just a huge, huge honor for me today to be podcast interviewing Dr. Mark Burhenne, DDS. He is a best-selling author and family dentist who has been in private practice 30 years. His focus is preventative and functional care with patients who come to him from all over the world. He received his degrees from the Degoni School of Dentistry in San Francisco and is a member of the American Academy of Dental Sleep Medicine and American Academy of Sleep Medicine. He is a TEDx speaker, and his advice regularly appears on NPR, CNN, Prevention, Men's Health, and Mind Body Green, and national television. He is the author of AskTheDentist.com, co-founded with his daughter in 2010. Dr. Burhenne believes that the mouth is the gateway to the health of the rest of the body. His blog, AskTheDentist.com, is dedicated to helping people beyond the scope of his practice. He wrote the Amazon bestseller, The 8-Hour Sleep Paradox, How We Are Sleeping Our Way to Fatigue, Disease, and Unhappiness for his and your patients. And after experiencing the disconnect between the medical professional and diagnosing and treating sleep disorders, personal interests are mountain biking, skiing, photography, family, preventive medicine, natural health, nutrition, health education. He is most often referred to as Dr. B by his patients. Dr. B, seriously, I am so impressed by your AskTheDentist.com. That's why I asked you to come on the show. I mean, even as a dentist, I could stay 10 hours on that site just reading articles. Job well done, and you probably do more marketing for dentistry than any individual dentist I know.
Well, that last sentence I really liked. That's what we're trying to do. Thank you. And coming from you, Howard, thank you. That's our intent.
Well, you know, a rising ship lifts all tides. I remember when Clear Choice came into Phoenix here, and a lot of the oral surgeons and periodontists were all nervous that they were going to steal a lot of their business. All they did is $1 gazillion of television advertising. I've had more patients ask me about dental implants since Clear Choice got here, and that's what they always say: a rising tide lifts all ships. And man, you are a B2C educator.
Good. Well, that's the definition of doctor, isn't it? It's the Latin root of the verb to teach.
Absolutely. So how did this journey start? What was going on in your mind in 2010, 8 years ago, when you decided you were going to start AskTheDentist.com?
Right. It's a good question. I actually had another website before that, before I even had Catherine, my oldest daughter, who's helped me found and create AskTheDentist.com, and that was called the virtual-dentist.com. And that was something I did on my own. That was back in the 90s. I've always been intrigued by the web. It's a great funnel. It's a great mouthpiece for getting information out. And, I like talking to my patients, but, sometimes you want to go beyond that. You want to reach out to a lot more people. The web is the best thing for that. And, of course, now, it's huge. I mean, the exposure. If you have a website that reaches out to millions of readers a month, you can certainly make a difference. And again, doctor is an educator first and then a healer.
You and I both graduated in 1987, even though you look about 10 years younger than me. You must have had some good, clean living out there in Silicon Valley. But,
Right.
Mark, I swear, you prefer to go by Mark or Dr. B?
Mark's fine.
When I read your book, The 8-Hour Sleep Paradox, which you can get on Amazon, I don't think anyone even mentioned those words when I graduated in 87. I don't even think it was a concept. By the way, I don't know anybody in dentistry who wrote a book, The 8-Hour Sleep Paradox. Not only you have all your reviews are 5-star, and you have 100 of them. I mean, my gosh, you must come from a very big family and have a very big family reunion to get.
Hey, we tried that.
You tried that.
We got a few reviews in there, but we have one bad review. It was the book binding was off. That's Amazon's fault. So anyway, no, thank you.
All
I mean,
but did I go to the wrong dental school in UMKC? Did they ever teach you about sleep apnea in Degoni when you were back there?
No.
When did this become a thing?
Well, for me personally, or it's not a thing, and I mean, I think we're beginning.
When did it become in the public's mind? I mean, when did you hear about it first? I mean, we didn't hear about it in '87.
No, we didn't, and it's not in the curriculum. And when I go to dental schools now and ask them, they essentially the reply is the same: the curriculum is full. There's no more room for anything else. But when did it? I think. I mean, for me, it was when we dropped off my oldest daughter at college. We were in the same hotel room, my 3 daughters and I literally woke up with them, bumping pillows into my face, telling me that I was snoring and I was noisy, and the short story is it turned out to be my wife, but I had no idea about sleep apnea. I mean, my parents had it; they didn't know. It runs in the family, so it was a personal experience before it became known to me, and I think that's how we learn these things. I mean, that's how we become good learners. Is if it affects us, then we absorb everything we possibly can. I had to learn it on my own. The dental curriculum is weak in it, although now you're seeing it in continuing education. And you've got the AADSM, which is a wonderful organization, and I think that's where I learned most of my, where I learned, most of my information on sleep apnea. That really changed my world. And of course, treating my wife, who was my first patient, she had a AHI score of 34.5. And we got that down to 0, and that was with an oral appliance. And this was sitting under my nose the whole time, a Herbst appliance. The first time I heard Herbst was in the orthodontic curriculum, right? I mean, that's what it was. It was a device to help Class 2 patients. But now it helps open up the airway. And bruxism. I was always very keen on bruxism. That always fascinated me and frustrated me at the same time, because I never thought stress was the modality or the etiology for it, especially in kids. And so when I heard that connection of trying to keep the airway open by bruxing, sleep bruxism, grinding at night, I just that was a big tipping point for me.
So podcasters tend to be young. Guys like you and me, we read a bunch of books. By the way, is your book available on audio?
It is not, and we've had that request, and I think we're gonna do that.
Well, I put.
Would you like to be the reader for it?
Absolutely. I'll tell you what. Seriously, it is Jeff. I was listening to Jeff Bezos a couple years ago, and I came out my book, and he said that he wasted $1 billion in 10 years because he had an inventory problem with books, because when you come out of the book, he doesn't know if he spent 1,000, 5,000, $1 million, and he had these warehouses, and the more books he sold, the bigger his warehouse were. So he wanted this one-size-fit-all print-to-order book machine. Took him a decade, $1 billion, and he said, damn it, by the time it was all right. That's why when you go to those bookstores, they're all the same size. It's because of that. And he said by the time he got it all done, the whole market went to digital, Kindle, and audiobook. And I put my book up there, and my gosh, Ryan made me sit down one day for 5.5 hours and just sit there and read my own book. Oh my gosh, it's 90% of sales. Just like this podcast. I mean, people got an hour commute, and they're listening to audiobooks. And
that's the key word right there. We're sitting a lot in our cars. Or walking for exercise. We have a lot of downtime where we're moving, and that's the perfect time. I mean, I'm an Audible book club member. I mean, when I drive, I'm listening to books and podcasts, and that's the way we get information now. A written word in a book is, a book like this, I mean, it's maybe an endangered species.
Yeah. I mean, I hear it all the time. I mean, I routinely have people say that they do all their cleanup of their house on Saturday morning, and it takes about 4 hours. And and they'll wake up and they'll find a 4-hour book, or they'll listen to podcasts, or it's commute, or it's everything. But I swear, whatever your sales are to date on your book, as soon as you come out of the audio, it'll be times 5, whatever you got now. But it's just the modem. But tell me this: so they're coming out of school again. They're young. Every time I tell people to send me an email, howard@dentaltown.com, tell me who you are, where you're from, all that. 25% are still in school. The rest are all under 30. Maybe one guy a week is our age. And but anyway, so she comes out of school, and she's going to say, look, I don't know anything. Where would she begin? You meant where should she start her journey? You mentioned the American Academy of Dental Sleep Medicine. Should she read your book? Start her out on her journey. What would her first 3 steps be?
That's a great question, because I think the sooner a young dentist gets up to speed on sleep, it will enhance their practice. It will kind of reinforce this whole root cause of where bruxism comes from and damage to the dentition, kind of a secondary way of getting periodontal disease. So I would read the book. I mean, I wasn't saying that a year ago. But now I get these dentists emailing me, and they're going, thank you for writing that book. It was a great introduction, even for me, a healthcare professional. And that's not why I wrote it. I wrote it for the layperson, but I would start with the book. It's 4.5-hour read, and it gets you up to speed, and it will point you in different directions. The next thing, and you mentioned it already, would be the AADSM, the American Academy of Dental Sleep Medicine. I mean, for the membership costs of $350, I think it's $350 a year, and then the cost of the yearly meeting, I would go to the first yearly meeting of the AADSM, and I tell you, that will get you up to speed. They have introductory courses, they have it well segmented, then you can take the more advanced courses, you can talk to all the professionals in this arena, and then you're done. I mean, you're on your way, and it's a fascinating area of dentistry, and I'm not saying medicine, you heard me right, of dentistry. Of course, it is a medical condition. So that would be my reply. Those two items alone. I mean, I can go on and on about
their
where to get this
headquarters is how do you pronounce it? Isle, Illinois. It's Lisle, Illinois. Lisle, Illinois. Their headquarters.
Yeah, I don't know. I've been there. It's outside of Chicago.
Okay,
it's nice.
So many. If you're wondering, kids, why there's so many stuffs in Chicago, because the American Dental Association. 211 East Chicago Avenue, so everything's down there in Chicago. So when they have their annual meetings, is it always the same place or same time or same bat station? Or
No. Well, this year, this June, which is in a few weeks, it's going to be in Baltimore, and then it's always in Seattle. I love the Seattle meetings. Actually, they're all good. Baltimore is wonderful. That town is gentrified. The Boston meetings are great. And then I think there's one in Minneapolis, I think. So, and then they have half meetings. Vegas, I mean, that covers the West Coast. That's an easy trip. You can just go for the day. So it's easy. It's very approachable. If you don't know anything about sleep, it doesn't matter. And then you can get accredited through the organization, and they'll get you up to speed quickly. And this is a group of dentists and physicians working together to educate and to illuminate that, this is something that dentists should be included on. And again, recognition of sleep apnea or sleep disorder breathing occurs decades earlier when a dentist sees it in the mouth than a physician sees it externally, like with a comorbidity of sleep apnea, like high blood pressure or insulin resistance. And so we're in the driver's seat here. Every dentist needs to get up to speed on this because it has dental implications, and there's a fix for that. It's a root cause of so many things that go on in dentistry.
I've been on Dental Town several hours a day since we actually launched it on St. Patrick's Day, 1999, since I'm 100% Irish.
Wow.
But this is Dentistry Uncensored, so I don't want to talk about anything anyone agrees on. So I want to tell you the bad talk about this. That so much of the training is just trying to get you to buy a machine, and they say, there's so many people say I went to a course, and as soon as I bought the take-home machine, it was all about the take-home sleep machine. True or false?
Right.
Is that a real concern, or do you not believe that?
Well, that's an interesting point. I mean, I haven't heard that, but I've seen it, and you're right. A lot of these courses are overpriced, and that's why I recommended the AADSM. And then they do sell you, or try and sell you, not only the machine, but a yearly or monthly subscription. It's basically a pulse ox, and I don't subscribe to that. In fact, in my training, I was told that you don't have to have low saturation of oxygen to have sleep apnea. I know a lot of medical institutions use that as well. These are the home studies or the home tests. And so in my book, I wrote about my frustration about not having an accurate way of knowing, if my oral appliance is working or whether my patient does have sleep apnea. And we now do have a test, and it's a company that I was hired by as a medical advisor, and it's called nithealth.com. It's nithealth.com.
That's your website?
It's a $200 exam that anyone can take. They send you a device, and it's a high-res measurement of your breathing patterns. We're here now. We've got that, but stay away from those courses that try and sell you something that's antiquated and old. That went a long time ago. I mean, I know some physicians that do that. You need a PSG or something newer than that. The PSG is the attended sleep study. Those are still hard to get, but it's getting easier. It's an incredible device, and it's touchless. Nothing gets wired to you. I can't tell you how many people come back from that sleep study, the attended sleep study, where they glue electrodes, to your face, to your chest, accelerometers, measuring airflow through the nose, and I mean, very few. I mean, I've had that test done many times, and you're a little bit, and you're a little hesitant to roll over or sleep properly. But this test is just something you mount on the wall, and you just jump into bed, and that's it. And it's in your own home, in your own bed, your own pillow.
Wow, that is and so you're saying you can do all of this without owning any take-home equipment?
Exactly, right. And as dentist, you can use it. You just have the patient call Knit Health. We'll have a program specifically, tailored to dentistry, where the reports come back, and that way we can, look at our results with the titration or calibration of an oral appliance. That's coming, but we don't. We'll wait till we get FDA approval, which we'll get. But I mean, no monthly subscription service, and just a very accurate test that a patient can do. I mean, without too much resistance. A lot of patients don't even want to go into an attended sleep study because the door doesn't lock. It's an unfamiliar place. There are people next door sleeping and snoring and being tested. I mean, that's not a conducive environment to get a sleep study. It really isn't. And it's expensive. It's expensive. I mean, What's your deductible on your healthcare plan, on medical? Most of us have, I mean, being self-employed, $4,000 to $10,000, maybe $20,000. Well, you're going to pay for that sleep study out of pocket, $3,000 to $4,000.
Yeah. Yeah, I went and had it done, and she said I was her favorite patient because all the strands on all the things, being bald, is really, she said.
Right.
She said that the most annoying thing for her is someone with a bunch of hair. So I was her favorite patient of the day.
Right.
So another thing, a negative. They're saying, well, if I do this, am I going to have to learn medical billing? And is that hard? Or so do you do this medical billing? Is that a hurdle to jump?
At first it was, maybe for the first few, but you learn to basically bill twice. The first time they're going to ignore it, and it is a medical code. There are no dental codes for anything to do with TMJ and sleep and that kind of thing, as you know. It's simple. I mean, there are courses on medical billing, and then they have these programs, software programs, where they do all the medical billing for you, but they take a big chunk. So I would learn how to do it. You just free.
What is the chunk?
It's high. I don't know, but it's high. I mean, I've talked to some sleep dentists, and they're like, oh, my God, they're taking a big chunk, and you don't need to do that. I mean, you can learn how to do this. This is as simple as billing just about anything else. You just have to learn how to do it. It's one medical form. You can learn how to do this in a matter of hours, and your auxiliary can do it. And then it's out of sight, out of mind. You're just going to treat the patient, and it gets billed. And, I collect up front because you never know if the insurance is going to pay. If the patient has, and of course you're going to educate the patient, if the patient has the sleep study, a recent sleep study, at least 5 years or younger, or more recent, and the prescription from the physician, which is being readily done now, physicians are on board now with the oral appliance. They've been educated. They used to think it was a TMJ, device that would make things worse, but now we know the studies are there that this can work and have a higher compliance rate in someone that has mild to moderate sleep apnea than a CPAP or APAP. And the physicians love that. They're okay with this. They need to write a prescription for it. Those two things are needed before you bill the medical. Now, Medicare is something different. I don't bill Medicare. That's a different animal. But billing someone's medical plan, I would say 80, 90% of it, we get an 80 to 100% coverage on a $3,000 to $3,500 oral appliance.
Now, are you working with just one lab to make these appliances, or do you use several different labs?
So I use one lab. I used several in the beginning, and I've now found my favorite lab. It was a Canadian lab, Strong Dental, strong as in strong, but they sold the American rights, Strong Dental, Randy Strong, who modified the Herbst. It's called the SUAD, S-U-A-D. It's very strong, very robust. All the early appliances that I made weren't as robust as this one was. And also this has a lot of adjustability. And I also like that it doesn't have a lot of internal volume. It doesn't fill up the mouth. You need room for the tongue. You got to let the tongue spread out, move forward, and relax. And so this now Somnomed SomnoMed bought the rights to making the Strong or the Suad in the U.S. So I use one lab.
SOMNOMED.
Yes.
Is that the number one player in making these appliances? I mean, do they do the most units? Are they the 400-pound gorilla?
Well, I wouldn't call them the number one player, but they're up there. They're definitely making a lot of appliances, and I think that's why they bought the right to make this Suad, because it's such a good device.
Yeah, and there is a lot of device, and I like to get specific because that's what they always ask me.
Right. I have it right here, actually. This is a model of it. I don't know if you can see that. It's basically a chromium cobalt kind of partial denture framework.
Raise it just a little
and then
higher.
they
There you go. Perfect.
It's got rubber bands. It's got the Herps struts on it. The struts come in different sizes. You advance the device by adding little Delrin spacers. You can use it with or without rubber bands. You can adjust vertical by adding acrylic or not. It's a thermoplastic material that, of course, will, as it warms up, grips more but less tightly. I've had great success with this device, and I've tried a lot of other ones. The SomnoMed Fusion is pretty good. It has a lower lab fee, but there's certain things I don't like about it. So that's currently my favorite device. I'm always looking for a new one, though.
What is that device called?
That's called the Suad.
Okay, that's
Suad
that's what
Elite.
Suad Elite. And
that's a Suad.
What is the lab bill roughly on something like that?
Good question. It's about $650, I think. $650.
And then what are you charging for this service?
$3,500.
And so that's definitely in the profit zone.
I mean, and it makes you look like a hero. I had 2 follow-ups today, and they're smiling. They're happy. They'll give you hugs. You've changed someone's life.
That is truly amazing. So I'm trying to make a cookbook for them. So basically, you're laying this out. You got the book for them, the 8-Hour Sleep Paradox, how we're sleeping our way to fatigue, disease, and unhappiness on Amazon. Ryan, can you push that out on social media? Yeah. Well, I think I posted for it. So on Dental Town, social media started with that with email groups. And you'd open, you subscribe to Dentistry at CompuServe or Dentistry, and you'd open up your email just crazy.
Bulletins, or
well, that's what the scientists that did the internet did on computerized bulletin board services. That's what Dental Town is. Dental Town has 50 categories, and the 50th one is TMJ sleep. And so we'll post it on that. We'll start a thread on that.
Yeah.
So that's good. And then you're talking about you get the book and then join the AADSM, and they have a meeting in Baltimore, June 1. Are you going to this June 1?
I am not, unfortunately. I won't be able to go, but I will be going to the next one. And I think that is going to be in Minneapolis, I think, or Boston.
And then, and you know what? I can't believe this to me. Like you take a group. How many people are members, do you think, of the American Academy of Dental Sleep Medicine?
Oh, that's a good question. I'm sure it's thousands. I can't say more good things about it. It's done so much for me personally, health-wise, even.
But the point I was going to make is, you want to go to Baltimore June. Yankee is in Boston, and it's in February. I mean, Boston is one of the greatest cities in the world, but not in February. And you go there, and it's like, and then you go lecture there, and they say, attendance isn't very good. And it's like, well, yeah. Did you go outside? Do you think anybody wants to go to Boston? And then you go to Chicago Midwinter meeting. I mean, Chicago Midwinter, just from the cab to running into the Hyatt, and your bones are shivering. I love it. I think it's so funny how all these smaller groups all go to great destinations at the right time of year. It's like London. It's like, do you really want to go to London in February and see what the North Sea is all about? No. But London, between May and October, is one of the greatest cities. London might be the greatest city in the world for 5 months of the year. And then the other 8 months of the year, you're
Right.
wondering if what you did in your previous lifetime to deserve this treatment.
Right.
So,
Right.
um,
Yeah. You're
so,
right.
so you're saying they don't have to need a machine that Knit Health, KNIT. I wonder where that name comes from. Knit, like knitting. I grew up with five sisters. I
That's
have to admit, I
I wondered about that. I mean, I've been working with him for almost 2 years now, and I never really asked, but I sometimes wonder about it, and then I forget to ask. Maybe it's knitting things together. I mean, there are a lot of things you have to pull together to have or to achieve overall good health. So I don't know. It's a good question. It did start out as a baby monitor, a very overqualified baby monitor.
So you start out with babies, and I think it's funny because when I started getting into sleep years ago, I mean, your mind. I mean, you learn something. You never say anything the same. It wasn't that long after that, and I was at a friend's house who had a 5-year-old, and I watched this 5-year-old on the couch. I mean, he's grinding his teeth, he's kicking his leg, and we all remember Grandpa sitting in the rocking chair, snoring loud and being all weird. But it's like, my God, that kid's only 5. And then you start looking into it. I
Right.
mean, there's people saying that if he breathes like that through his whole development, that he wouldn't have been maximum
Right.
developed in brain and size and fitness. I mean, you just look at him
Yep.
and think of how many vaccinations he got, how many pediatrician visits. He's already been to the dentist every 6 months, and he's 5 years old, and
Right.
nobody's picked up this kid can't breathe.
That's a very well said. That's a great little story that everyone should keep in mind. And so I treat a lot of children. Again, I can't diagnose sleep disorder breathing, but I can screen for it. And I work with ENTs that are knowledgeable in this area. You can't just refer out to any ENT. Some of them will just turn around and say, forget it, the kid's fine. Even though their mouth breathing, tonsils, and adenoids are swollen, they're acting out, they're not sleeping well, they're bedwetting. I mean, it's amazing. But you're right. I mean, again, as a dentist, I mean, you see kids at what, age 1, typically, sometimes by age 2 or 3, and you can make a big impact on their lives, especially if you catch a sleep disorder breathing issue, mouth breathing, because it leads to poor development over time, and crowded teeth, and then they get the wrong type of ortho, and then they have sleep apnea for the rest of their lives. So let's fix it before it starts, and that's a great opportunity for us dentists.
But what you're doing, it's not the American healthcare system. The American healthcare system, you see your doctor, you got a 5-minute appointment. Well, I'm having trouble sleeping. Okay, here's Ambien.
Yep.
I got your blood work back. You got high
Yep.
triglycerides. Here's a statin. And you go in there
Right.
for 10 minutes, and he tries to write you 5 prescriptions. And that's
I
the
know,
U.S.
yeah.
healthcare system. And we spend twice as much
Well,
per
that-
person. And
Right.
I was born in 62. 1962 was the last time that the life expectancy went down 2 years in a row. And the last 2 years,
Right.
and this is 2018, 2016 and 2017, it went down. And they're like, you would have thought
Right.
55 years ago by now it'd be going up, up, up. And it's gone down the last 2 years.
Right.
And then the stat that just blows
Yeah.
my mind is that Americans are 5% of the world's population, which is almost nearly 8 billion people. And in 2017, we took
Right.
half the prescription pills.
Yeah,
So see,
that's shocking. And
if you really
but that's-
want to cure sleep apnea, you need to just make a pill. Have you thought about that? Just making a pill.
Well, yeah, of course. I mean, that's how we're wired to think. And, we're no better than physicians. I mean, Western dental care is reactive. In other words, if there's a hole, we can fix it. If there's a missing tooth, we can fix it. Medicine's the same way. Medicine is great at patching you. Let's say you break an arm or you bash your head in. I mean, we can fix all that, right? But no one's looking for root cause and prevention. Again, I don't know what you were told in dental school, but we were told that we were better than physicians in a way because we were more preventative orientated. And I don't see that in dentistry. In many ways, we're just like modern Western medicine, is that we are reactive. We fix things. We don't talk about a dysbiosis in the mouth and how the oral microbiome is causing cavities and diet. We're just talking about acids dissolving calcium, and we can go in there and fix it. We've got plastic, we've got metal, we've got gold, we've got cubic zirconia, whatever, porcelain. And that's got to change. We need to be more like comprehensive, healthcare practitioners. Physicians don't get paid to look for root causes. They've got they've got their 15 minutes, and you can write meds and prescriptions in those 15 minutes. That works, and you can bill for it. It's a flawed system.
Now, you don't take Medicaid, Medicare, PPOs, or Delta. You don't take any of that, do you?
No,
I mean,
don't take any of it.
I mean, the Doctor B, is the B stand for unicorn? I mean, because a lot of them are really burned out. And what's neat about looking around the world, like I always tell people that, you don't need an original idea with the S&P 500, with the Russell 2000, with 200 countries. I think politicians, I mean, no matter what problem you have, why would you need an idea? There's 200 countries. Somebody's got a better outcome than you. And it looks like, to me,
Right.
America and its PPO looks like England when I got out of school 30 years ago, when everybody worked for the NHS. And every year, inflation
Right.
and your costs would go up, and they would lower the reimbursement. And finally,
Right.
those two lines had to merge, and now 5,000 of the UK dentists flipped them off and said, I can't treat my own child like this, so I'm not going to treat people like that. Because
Right.
it's very confusing when they come out of school, when they see people buy a Honda, the median average price of a new car in America is $33,500 a year, and the average American will buy 13 cars between the ages of 16 and 76, and they're like, okay, they got an $800 iPhone, they got a $33,000
Right.
Honda or Toyota, and I'm supposed to do this filling for $100.
I know.
Were
I
you
know.
always off the grid with that, or did you finally, like
Yeah.
the NHS doctor, said enough's enough and walked away?
Yeah, it was the latter, but it happened early in my career because I was limited. My hands were tied. And I agree with you, and I hear a lot of complaints about the cost of dentistry. I think we're undercharging, and I think we need to charge more and provide more of a service. I think I think dentists need to practice together, like physicians do in group practices, and to lower the overhead. And I think we need to provide more of a hospital-like environment where, when we look at, periodontal disease, we're looking at it in terms of a root cause kind of way of thinking, and we're giving nutritional advice, we're measuring the type of bacteria and the flora or the biome in the mouth, and we're making decisions based on more data. Right now, we see gum disease, we see deep pockets, and we go in there with our lasers and our scalers, and there's really no way of knowing, except over time, that we're doing the right thing, but it's not very evidence-based. There's another term that gets thrown around very loosely, but I think we need to bump up our game here and go more clinical, more high end, and then insurance has to follow us, hopefully, with that. They won't. I mean, they'll fight us on that. But right now, we're just basically filling holes and scraping teeth. I mean, I'm exaggerating a bit, but that's why sleep is so important. That's why you have to incorporate that into your practice. Also, nutritional advice. I know that smoking cessation is a required thing now. It's a standard of care thing, but I don't know how many dentists do that. So it's something that we need to work on. I think does it start in CE or does it start in the dental curriculum? I don't know, but we're talking about it now, which is great. And then there are hundreds of thousands of dentists listening, so that's a start.
What I can understand is that the person who holds all 52 cards of this deck are the dentist. And they just fold to the insurance, the Medicaid, the Medicare. They did the lawyers. They just
Right.
it's like, if the world's 2 million dentists all disappeared tomorrow, 8 billion people say, "Oh my God, where's my dentist?" Dentistry is very different. Like only 5% of Americans will see a chiropractor this year. But every single human on earth at one time in their life is going to need to see a dentist.
Yes.
And so I want you to
That's
put
right.
your dad hat on. You're given the graduation talk at Dagoni, and they're coming out of school. They got $400,000 in debt. They're 25 years old.
Okay.
And what would you want to tell yourself if you were at that commencement hearing? Give advice to the kids in dental school, since that's 25% of the people you're talking to right now.
Right. Boy, that's a good compound loaded question. I would Yeah, I would. First of all, I would say I feel bad for them. I mean, I came out with a lot of debt, but not that much debt. I mean, that's a big chunk of debt. I would say, first of all, stay away from the big corporate dental concerns. You know, Western Dental, Smile Care, Smile Centers. The minute you step foot in there, you're going to be practicing dentistry not the way you were taught in dental school, and you're going to start feeling bad about yourself, and you're not going to necessarily learn that much. I did that for about 10 months, and I learned a lot, but I learned what I didn't want to do. And I think that was part of my decision not to take all these insurance plans. That's the first thing. Just don't get tempted or pulled in by a salaried job that will start, maybe beginning to pay off some of your debt. I would find a dentist that you admire, someone who's, doing a good job, where patients, they're getting good reviews, they're not necessarily dealing with insurance, or they're managing it properly, and they're treating their patients well. It may even be your dentist, your childhood dentist. Maybe it's that. I get a lot of that from my patients. I've seen them grow up. They become ENTs and dentists, and that's very gratifying, of course. But they know your style of dentistry, and that's the reason they became a dentist, because they thought that all dentists were that way. So I would, like in the old medieval times, there was an apprenticeship and I forget what the analog to that is, the person who does the training, and lock in on that person, and do an associateship, and with an option to buy, and work with that person for 10 years, or 5 years, however long it takes. But that's the only way to learn something properly, is to emulate and learn from someone who's done it. Don't take advice from people that their actions aren't speaking louder than their words. In other words, only take advice from people that you like what they've done and you admire what they've done. So I would go that route. Again, stay away from those big corporate clinics where you can't put your name on the door. If you can't put your name on the door, walk away.
I always look at my dental office and say, okay, if I died tomorrow, how would this treat my grandchildren when I was 6 feet underground? You know what I mean? What is the corporate culture of this place? And she's coming out of school, and I'll tell you, whenever you get to a place and they're telling you, well, if they have over 5 millimeter pockets, you got to have these arrestin chips, and when they say things like, well, 60% of your new patients are supposed to have periodontal disease, it's like, what? I thought only people that had periodontal disease had periodontal disease. I didn't know there was a quota. So as soon as you start treating other people in ways you wouldn't treat yourself for money, you're going to feel bad. You're going to feel dirty. You're going to do depressed. And when you do things you don't like to do for money, it leads to disease and depression. I mean, even the Constitution says, you have the right to pursuit of happiness. No one ever talks about that. They always talk about, this amendment or that amendment. Right. You got the right to pursue happiness. So, if working in these clinics was a great idea, then they would all be happy and people would stay there for 5, 10, 20 years. And is that what you see? Do you see a bunch of people going in there and staying 10, 20 years?
No, I mean, they branch out, or they work for insurance companies. I mean, they sell out. Medscape today, I don't know if you saw the Medscape feed, physicians have the highest rate of suicide now, of professionals. And I think it's just what you said.
That on Medscape, physicians have the highest rate of suicide?
Yeah, they've got their 15 minutes to write a prescription, and they know deep down that that's not going to fix things. It's a short term. It's going to make things worse even. I mean, the side effects, and they're part of a system that I don't think they were aware of before they went to medical school, or they don't want to be a part of. So I know a lot of physicians personally. I've done TEDx talks with them. I've talked books that we've written and everything, and they're kind of in the same position we are. Who's that? Is that your granddaughter?
Yeah, she just came home from school. Yeah.
Oh,
but that's the thing with the granddaughter. I mean, you should be doing dentistry like you'd want to do it on your granddaughter. And once some big corporate thing says, well, no, you can't sit down with your granddaughter and tell her about, lowering cholesterol with exercise and diet, or talking, and you got to see a quote, and you got to see, you only get 10 minutes to see a patient. I mean, once you cross that line, it's not going to be good.
Right. Well, I came out of dental school, And the first time I had to put an alloy into a kid's mouth, I kind of thought, oh God, I don't know if I can do this. And so I went exclusively to composites, even though back then they weren't perfect. But it all worked out. I mean, they lasted, they worked, they were fine. I mean, there's no reason we should be putting, a neurotoxin into the young people of America. That's just ridiculous.
I want to add another thing. I know how they think. I'm in a lot of dental schools each year. Here's where they come out.
Yep.
Rome wasn't built overnight. They come out of school. They say, okay, I got a limited budget and time. You know, they got to work, they got to sleep, they got to eat. What would be, and I'm going to talk about the ugly. I mean, they have $400,000 of debt. They have to make money. Should she learn Invisalign? Should she learn how to place implants? Should she learn sleep medicine? Should she go to these institutes and learn TMD and occlusion like Pankey and Coyce and Spear? I mean, she's got so many choices. Where do you think sleep medicine fits in all these decisions? And if you were 25 and you had $400,000 student loans, where would you begin? In what order would you learn it in?
Boy, that's a really good question, Howard. Well, the easy answer is all of it, but that's expensive and time. It takes a lot of time. I would work with sleep and Invisalign. Implants, I think that's something you can work on a little later. I would learn how to restore implants. That's not difficult to do, and work with a good surgeon, and then transition slowly, maybe after you get your practice going. As an associate, it's hard to do all this because you don't own the practice. So I would work on sleep and Invisalign. It's because it's easy. It's not high. You're not buying a lot of equipment. When you buy a lot of equipment, for implant placement, and by the way, that could all change. I mean, I think titanium is probably on its way out, and that's going to be a big equipment change, right? I mean, if we go to ceramic implants, right?
Okay, so what you're alluding to is the largest implant company in the world, Straumann, as far as units, bought. That's the high dollar. They bought the value system, Neodent, but they just bought a big. They just launched their calcium, and then Danaher, which is the largest dental company in the world, $17 billion. They have their high end Nova Biocare and their value implants direct. But everybody's coming out with a ceramic because it's. Right. Some people, there's no consensus in the marketplace because ceramics aren't even 1% of the market yet. But there's a lot of people that say, well, implants at 5 years, 20% have periimplantitis, and in 9 years, the research shows 40 to 60%. So you're saying you're one of the believers that the titanium metal is doing something and is part of the problem with periimplantitis?
Yeah, I do. I think I'm seeing an immune response, definitely. I don't see it that often, but I see it 20% of the time, maybe 25% of the time. And, I don't like it. I don't like seeing pus coming from the sulcus.
Do you see any connection with race? Because if you come out 30 years ago, remember 30 years ago when they had PFM, they had the value PFM to precious metal, porcelain to precious metal. Then that was the premium. And then the value was porcelain to base. And if they look like you and me, the skin would acid leach and like costume jewelry. There'd be like green tattooing around the finger under the costume jewelry, and it'd be a tattoo around the gum. But I didn't see that in my American Indians, my Mexicans, my African Americans. It just seemed to be Northern European. Do you see that same association with titanium, that it's a Northern European thing, or do you think that Asians, Africans, and Latinos are having this too?
Right. Yeah, I see it as, well, with the crowns and you're talking about metal poisoning, which is kind of a strong term. I think it's more readily viewable on skin that's pigmented lightly, on mucosa, oral mucosa that's pigmented lightly. And I think I've seen it. You just have to look a little harder or, provocate the tissue and you'll see the bleeding. And so I see that little purple corona. I call it a purple corona. I mean, there are many different terms for it. And I've stopped using base and noble metals. If I use metal, it's only high noble. But with implants, I don't have enough information on that, but I see it. It's prevalent, and I'm tired of seeing it.
The other thing, let's not kid ourselves. Those implants aren't pure titanium because that's not ideal. So they have other elements in there, and it might be just one of those little trace elements in the alloy to make it do what it needs to do. It
Right.
might not even be the titanium, because there is no such thing as a pure titanium
Well,
implant.
exactly. And then their coatings and all that. But it could be the titanium as well. And have you ever thought of this, Howard, that the reason, the bone integrates with the titanium is that it's an immune response. In other words, it's grabbing the implant because it's afraid of it or it's reacting to it. It's not necessarily a good reaction. It's a negative reaction. But for us, because it integrates, we can put a tooth on it. I don't know. That's just metaphysical kind of stuff. But I think, and root canals kind of have the same reputation. I mean, a poorly sealed root canal is basically a kind of a sepsis machine, right? I don't know. It's we need to redefine what we consider to be a success with an implant. And right now, if there's no mobility, that's a success. Well, what about the effects to the oral microbiome and tissue? And what about systemic effects? Are there systemic effects down, to your big toe and to your heart and to your liver tissue? And, is the kidney responding to that? Is it having to work on fixing, that reaction? The big problem has always been, and dentistry knows this, is inflammation. We die of that. Chronic inflammation is a real big bad boy, and we need to deal with that. That's what perio disease is. That's what a cavity is. I mean, and we talk about it, but it's all kind of lip service, I think. And I think implants do create a systemic kind of effect. I mean, and it does activate the immune system. I mean, the studies are out there. I've read them. I mean, I'm not an expert on that level and microbiology and biochemistry and all that, but I've seen it.
I am so into research that I've never told Ryan this in 22 years, but you had an identical twin brother, and I gave him up for adoption at birth for the control. There you go. And then I figured you guys could meet up when you're 60 and see what was DNA. Yeah, Ryan just sent it to me on Medscape. Physicians experience highest suicide rate of any profession. Holy moly. Holy moly.
Holy moly.
Holy moly.
It's managed care.
I want to say another thing about
They're controlling things.
I want to say another thing that a lot of people don't think about, especially the young ones listen to us under 30, about sleep medicine and Invisalign, and that is, I know so many dentists. When you're doing molar endo and you're placing implants and you're pulling wisdom teeth, you need some really exact vision, eye-hand motor skills, whatever. And then something happens to them. Mm-hmm. They can have an injury, they can have a car wreck, they can have a stroke, this and that and this and that. But doing hygiene checks, Invisalign checks, and sleep medicine checks, don't you think that's a lot less technical motor skills, eye-hand surgery,
yes.
than molar endo and yes. removing wisdom teeth? And there are a lot of dentists
yes.
that I know personally that after they had the carpal tunnel surgery, after they had the ski accident and skied into a tree, after they had the car accident, thank God I had ortho skills, sleep apnea skills, hygiene check skills, because some of them forever lost. And it might have just be psychological confidence where something happens to them and they just don't feel like they can go back and do that, because it is more of a animal spirits, eye-hand surgery to do molar endo and pull wisdom teeth and place implants than do Invisalign, sleep medicine, bleaching, bonding, veneers, hygiene. Do you agree with that?
Right. Absolutely. I agree with that. And I think even for older dentists that aren't handicapped, I mean, if they want to continue to practice, sell a portion of the practice or sell the practice, work in your own practice on your patients and do a little sleep dental work, do some Invisalign. You could do a little consulting. I mean, as you get old and you've seen a lot of patients and results and all that, you're experienced. Don't go away. Don't retire.
We graduated the same year in '87. What is your definition of old now? I'm just curious where your number is. Are we there?
Well, I just turned 59, but I mean, I see a lot of dentists in my area working into their 70s, but their clinical skills. I mean, we wear a lot of hats in dentistry, and after a while, you slow down and you don't have the dexterity or the eyesight or even the core strength to bend over and lean over the patient and get in, and so loops have helped there, but. I mean, let the young guys come in. Let them buy your practice, help them, kind of foster them, nurture them, and you can still do the things you really enjoy, like sleep dentistry or Invisalign. Although Invisalign, let me ask you a question, Howard. What do you think of these Smile Direct clubs? How are they going to get away with that? I mean, they're not seeing the perio, they're not seeing the contraindications or the issues. I mean, how is that happening? Can you answer that?
It blows my mind. But this is
Yep.
okay. So if you just got to the United States, because a lot of dental students, they just got to the United States freshman year. They come from all over Asia,
Yep.
Africa, everywhere. In my
Right.
55 years, the Washington, D.C. federal government has always been pretty much useless with about 11% approval rating for decade after decade after decade. The game changer always comes from a renegade attorney general straight out of school, wanting to make a name for himself, and takes on big tobacco, takes on something. So what I'm predicting is that even the Facebook security deal in Cambridge and all that stuff, there's no way the Congress or the Senate will do anything. Hell, did you see Mark Zuckerberg trying to
Right.
explain that to a bunch of? It looked like he was at a senior citizen care center.
I know, yeah.
The questions they were asking is like,
Right.
I'm surprised he didn't. Anyway, bust up laughing. But it's always there's 50
I did.
states, and there's always one renegade attorney general. They did it with Microsoft. Remember when Microsoft, some guy went after him. The next thing you know, he had 22 states sign on behind him. So yeah,
Right.
what's going to happen is they're going to trip up and fall down on one patient somewhere on a Smiles Direct Club where some girl
Okay.
in a mall scanned the tooth. She's probably
Yep.
long face,
Right.
jacked it all up, and then they're going to have a
Right.
Tyrannosaurus Rex because he wants to build a career for himself. That's why they go into, they come out of law school, and before they go develop their big, expensive private practice, they want to go to the other side first. They want to cut their teeth on the government
Right.
side. And so a lot of people think, well,
Right.
those government, they're all young and lame and all that. No, there's a lot of really ambitious young attorneys at these attorney general's office in 50 states. So that's my prediction, because that's all I see. You see patterns.
Yeah.
I want to
Right.
I want to switch. I want to go back where we started. We started this thing. I can't believe we've already done our hour. I want to go back to AskTheDentist.com, because when I read the AskTheDentist.com, what's funny for me? I was born and raised in Wichita, Kansas. And I went to college at Creighton in Omaha. I went to dental school in the University of Missouri, Kansas City.
Yep.
And everybody in the Midwest knows that all the smart decisions, they start in California. And they slowly roll over. They just said, everybody in Kansas when I grew up, they say, well, if you want to know what it's going to be like in 10 years, just go to Disneyland and talk to someone in California. When I talk to dentists and I read AskTheDentist.com, you guys are, Silicon, hell, you're in the middle of Silicon Valley. And when I read
Yes.
all your Ask the Dentist, natural mouthwashes, you don't like amalgam, you're already backing out of titanium. Why do you think, my dad always said you guys were first because you're all hippies. And so so why Berkeley? It's a culture of innovation. Steve Jobs. Why do you think that people like you already thinking about, I'm ready to go from titanium to ceramic, when nobody in the Midwest is thinking about it, and it'll be 10 years? My succinct question, why is California always 10 years ahead of the United States? And if you think they're wrong, if you're young and you think they're all a bunch of crazy bowl of granola, I used to always hear in Kansas, California, they're full of granola, they're just a bunch of nuts and flakes. Well, go back through history every 10 years. Everything you guys did that was nutty and flaky eventually ended up in Kansas. Why do you think that is?
Well, that's a good question. I never thought of it that way. I think I live and work in an environment where everyone is innovating. My patients are VCs, they are engineers, they work at Apple, they work at Google, and so I'm just used to that. And then when you have an original thought, or you are counter or contrary to the byline, what the profession thinks, then you're not criticized. So I think it's the environment I'm in. I don't know. I was against mouthwash. I mean, killing things in the mouth. I mean, that just didn't make sense. Putting fluoride into water. I mean, that stuff didn't make sense to me early on. But because maybe where I work and live, and because of the people, my peers who I'm around, maybe that's where it came from. Maybe I'm comfortable expressing myself and being contrarian. Although I'm not always that way. I don't know. I don't know if that's. I mean, my dad was that way. I mean, maybe it's a family thing.
I really don't know if I should say this on my show, but it is Dentistry Uncensored, so I'm going to say it. How many times have you heard people say the biggest problem with Google and YouTube and Facebook and all those companies is that there's no way to talk to a human, that you can't get anybody on the phone?
Yeah.
You always hear that?
Well, absolutely.
Yeah. So
Drives me nuts. Absolutely.
So every time Dentaltown has ever had like a question like, we got a community, we got an app, and our programmer's like, well, we don't know, we don't know anybody Apple. We just have to submit it, and they send it back, and we don't know. And I always say to them, well, just tell me where the headquarters is. And they'll say it's in Cooperton. So I'll just Google Cooperton dentist, and I'll just get on the phone, and say, yeah, this is Dr. Howard Friend. Is Dr. Mark Burhenne there? And I get on the phone, I'll say, hey, buddy, I got this problem with this company, this app. Do you have any patient that you could give me their cell phone number, or I could send you an email with the problem you could forward on? Every single time your homies in the town I don't care what the company is. I don't care if you're trying to find, the president, all the top people in the Fortune 500, they all have a dentist. And those are the most likely people to go to get their teeth cleaned every 6 months. And what's so funny is if you just know where the company's headquartered, just get the zip code, then put the zip code, the dentist, start calling the office. What they used to call that, we were little 6 degrees of separation, that you were 6 relationships away from the Pope or any leader. So Dentaltown, we've been saved so many times over the years. Now, is that a HIPAA compliant deal?
Well, it's always about community.
It's always what?
Yep. It's always about community. Community works well. It always has. The electronic communities I'm not very fond of, but I mean, if we stick together and learn from each other, that always works. It's never failed.
Now, if a dentist, the dentists are always looking for articles to populate their Facebook page, all that kind of stuff like that. So is it cool if they post your article, just links to your articles?
Absolutely. It's already happening. People do it all the time, all over the world.
I've already ripped off all your stuff, so I'm glad to get permission.
Okay, good.
It's always better to ask for forgiveness than as ask for permission. But I can't believe.
Absolutely.
So, is there anything else you wanted to talk about that I wasn't smart enough to ask?
Gosh, you asked some good questions, actually. I'm just concerned for the profession, and I just hope that we keep it all together. And again, I mentioned it before, I think we got to up our game. I think we got to go more root cause and be a little bit more scientific, medical, more we need bigger, better facilities, and we got to figure out a way to get reimbursed for it. We got to stop just, filling the holes.
And the bottom line, like a lot of times a kid will ask me, and they'll say, in Dentaltown, they're posting a case, and they're saying, God, Mark, would you retreat the root canal, or would you pull it and do an implant? And I would say, well, the first damn thing you say to yourself, what would you do with your tooth? Follow your tooth.
Yeah,
I mean, you can present the options to the patient, but I mean, obviously, most people are going to say, like my physician says, well, you can do this or this. I'm going to say, well, what would you do if you were me? You know what I mean? And once once you're treating the patient exactly how you treat yourself, or you could inverse that and say exactly the opposite of how you'd treat one of your children, so once you do that, it's easy. So if you catch yourself in a job doing things that you don't like to do for money, leave. Be true to yourself, because at the end of the day, the 211,000 dentists and the 1 million MDs hold all the cards, and everybody else just. It's funny. It's one of the greatest political scientist quotes in the world. They said, when you study history, it said, all the people always go along with the government until they don't. And that is, you beat them up, you push them down, you push them around, then one day they tear down the Berlin Wall and say, we're done. I mean, nobody predicted the Arab uprising. Yep. Nobody predicted, everybody always goes along with what you're doing to them until they've had enough, and then they don't do it anymore. So just everyone be true to yourself. Same thing I asked for my 4 boys. The only thing I want them to be is happy and healthy. And Mark, it was
Right.
just an honor that you would come on and give me an hour of your life to talk to my homies today.
Oh, anytime.
Thank you
Call
so
me
much.
again anytime.
All right, buddy. Thank you so
Love.
much for all that you do for
Thank you.
dentistry. Thank you for educating so many consumers. Ryan, thanks so much.